See if anybody comes in. Anybody here? Nobody? No, there's some people on. AJ, can you hear me okay? All right, good. So what's going on, folks? Just thought I'd come on live, give it a couple minutes, see if any more people come on. What's going on with you all? AJ, are you still down at Nicole's? So, thought we'd talk about some festivals and some stuff that's been going on, classes and stuff that I've taught, festivals I've attended, things like that. We've had a live tissue class. I've done a couple of trauma classes. We've done some classes at some festivals. So we've been pretty busy. I've got a lot of stuff coming up. I've got a lot of classes. I'm getting ready to put the schedule out. I've got one in New London, Ohio. We're working on one in Chattanooga. There's going to be one in the Charlotte area in August. New London, Ohio is going to be in August. We've got one scheduled for July, I think it's 15th and 16th. It's the Monday and Tuesday after Alumni Weekend in Camden, Tennessee. So, yeah, we're going to be busy. We're filling up the summer now. Oh, you're in St. Louis. Fun, AJ. I hate driving through there. So, yeah, thought we would just discuss some of that, see what you all have to talk about, and all that good stuff. So, building a couple of kits. I don't know if you all can see that. Let's see if that's any better. Maybe that'll help. There we go. Building some kits. This is the SOE Special Operations Equipment Pocket Organizer. I actually make an IFAC out of it. So I'm going to build a couple of these. I just got some of them in. They're going to be available on my website. No, I don't remember how much they cost, but I'll show you how we put them together. Got a compact mini trauma dressing. One package of S-rolled compressed wound packing gauze. One nasopharyngeal airway that we put in here, and to wrap it up, got two high fin chest seals. Those go in this back slip pocket here. So it's a little pocket kit. This is actually the one I carry every day with me. In fact, here's mine now. That goes in me. I mean, at minimum, I'll have a tourniquet on me, but 80% of the time, I've got that kit with me. So yeah. Oh, Forbo. Yeah. I know who you are now. Just didn't recognize the YouTube name. So, you guys, AJ, besides driving, what did you all do this weekend? Did you have fun? I've been planting all day. I did some container gardens that I was planting some extra stuff, put some peppers. I'm going to do a bunch of herbs in some. So yeah, it's had my hands in soil all day long, which was good. This is the biggest struggle, is to stretch this out a little bit. And then I leave this to let you all do with it. I mean, you could wear this around your neck, but on mine, I cut this down to where it's basically a handle that I can grab a hold of, pull out of a pocket or a pack, and, you know, I've got a few extra things thrown in mine, a couple Band-Aids, stuff like that. I mean, I've always got a boo-boo kit with me, but I try to keep it with me. Jason, what's going on? Jason, that thing we were talking about the other day, that's pretty much a go if we can work it out. He's in. So yeah, this is just a pocket kit I do. It's just all your essentials. These are the things that'll, kill you in 5 minutes or less, unless you do the, paired with a tourniquet. Bleeding out, but a large laceration may not be an arterial bleed, but that has something with you. And then, a penetrating chest wound, sucking chest wound for your chest seal. I keep in mine, I added a decompression needle for that, but it's got everything that'll kill you. A few minutes or less, and then I add my pack of cards. To this, got a few people's cards I like to put in. SOE, Radio Made Easy, Evans, and I don't know if you all can see that. Light might be too bright. Turn this light down some. Thunderhill Farms. Kiri. AJ, you send me some cards. I'll put yours in my orders too. Packed orders a lot this weekend. Had several, and then I had several that were a little past due. Took a little while. I was waiting on some components, specifically some tourniquets, soft T wide tourniquets. And believe it or not, 6-inch trauma dressings are very difficult to be had right now. The North American Rescue ones are all on back order. I was wiped out pretty much from the Kentucky Sustainable Living and the Self-Reliance Festival, stock-wise. And then I had a class right after that. So I was pretty low on stock. I'd ordered a bunch of stuff right after Self-Reliance. Took a little bit longer than normal, but I've been packing people's orders up. Here's one going to Washington State. Let me see. Joshua Smith, yours is heading to Las Vegas. I've got Texas, New Mexico in here, Pennsylvania, Tennessee, Ohio, Florida, South Carolina. So I had quite a few orders. Got a few stacks of boxes here that'll be going to the post office tomorrow. So yeah. You're welcome, Kiri. I just like to support the small businesses. Got a lot of classes coming up. Just to let you know, one, the last weekend of June in Bowling Green, Kentucky. Kentucky Sustainable Living is starting to do some regular training workshops, so I'll be in Bowling Green June, I think it's the weekend of the 29th. June, yeah, 29th and 30th. I'll be doing a class in Bowling Green, Kentucky. July, let me just look at the calendar here. 14th and 15th in Camden, Tennessee at Tactical Response. In August, the weekend of, I believe it's, oh, wait a minute. Wrong year, sorry. Let's make that 15th and 16th. And yeah, June 29th and 30th in Bowling Green. July 15th and 16th in Camden, Tennessee. 17th and 18th, New London, Ohio. The first weekend of August, I believe we're going to be in Charlotte, North Carolina. I've got, I'm working on some dates for Pennsylvania. I'm working on dates for, there'll be one in Ohio, Summit, Ohio. And we've got one that'll be coming up in Chattanooga also. So I've got several classes coming up. I'm going to do one here in West Virginia next month. And got some other dates open. The Homestead Apprentice was put on hold. So I did have some dates closed off for that for filming, but that has been put on hold. So had some dates open up. So if anybody wants a class real quick, let me know. I've got some dates open in June now. So what else have you all been up to? How was your all's weekend? Yeah, the one in Bowling Green is going to be a little bit different. All my classes are different at each of these places. The ones I've mentioned, they're all open. The one in Bowling Green, you can sign up at KentuckySustainableLiving.com. They're actually hosting it, so you can sign up and pay there. The one in New London and Tactical Response, you can go to my webpage, homesteadmedical.us, and sign up there also. On that, you can pay for those classes directly on my website, and we will get you a seat there. We're working on a few other things, some classes. I've got some new classes that are going to be coming out. I've got new products that are coming out. I've got a dental kit that I've been working on. I'm going to do some collaboration with some people on that. Yeah, so I've got a lot of stuff going on. Been busy, which is good. Not complaining. Like I said, I've got 4 stacks of boxes here going to the post office tomorrow. So yeah, it's been good. We've got new product. The EDC tourniquet wide, you can see how small this is. It's a very small tourniquet compared, hold on. Getting orange ones that are contrasting. So you can see the size difference in, this is a CAT Gen 7. This is the EDC or EDQ tourniquet wide. Both windlass tourniquets, of course. This I've used on people. Soft T I've used on people many a times. Both those tourniquets. This one I have not, but I've tested it. And I'm confident that it'll work. It seems to be a good tourniquet. It's very small, as you can see, very thin profile. If you kind of put them up together, you can see where this is much thinner profile-wise than the CAT. I'm not saying get rid of your CATs and go to this. I love this. I still carry these, multiple of these with me. But in my pocket, on my body, I've been carrying this. But those are on our website. Same cost as the CAT, 30 bucks. So it's not going to break the bank or anything like that. But I highly recommend them. I've got some available. I think I need to update my inventory on it. If you try to order it and it says it's out of stock, I do have some that I just got, and I will update that. Let me see what Carrie is doing here. Oh, Carrie, you're making euros. Glenn, what's going on? And Glenn, I wish I was there. I wish I was there to eat it with you all. Anything you all make is good. By the way, Glenn makes fantastic corned beef. Carrie's husband, if you don't know, from Thunder Hill Farms. D. Mullins, how are you? My son Chase is there. So it's good. This is all good. Got some people in here. So what do y'all have? You have any questions, anything? Like I said, I've been pretty busy with stuff. We went to Kentucky Sustainable Living Conference. We taught a pre-conference class there, a one-day class. A lot of people there, a lot of new people I noticed, and I think that was kind of consensus of everybody there. Carrie, Thunder Hill Farm, she was right next to me. Her and Glenn were right next to me. On the other side of them was Grumpy Acres Farm, their booth. And we all noticed, and then also talking with several other vendors, a lot of people asking who were new, where do I start? What do I need? Very successful, sold a lot of equipment. I did a talk there also during the conference on Saturday, I think. Well attended, a lot of good questions. But a lot of people, new people into preparedness, homesteading. And so you can kind of feel a change in the world that's going on, a change in the tide. Went to SRF, smaller than normal, but still a great turnout. Sold a ton of equipment there also in kits. It was real good. A lot of the same people were at both conferences. I spoke there Saturday morning, had a really good turnout. I was in the second tent, standing room only. And Sonny even spoke while I was speaking. He added something, which anytime Sonny speaks, it's incredibly value information. But had a really good time on both of those festivals, as I always do. Kentucky Sustainable Living Conference grew like crazy. I think the first one we had 400 and some. This one was well over 600, 700. Jason, correct me if I'm wrong. They're both are going to have conferences again in October. Last weekend of October for Kentucky, first weekend in October for Self-Reliance Festival. But Kentucky, we had a lot of good time. I met Chris Weatherman, Angry American. I met the Angry Prepper, Jason from New York. He came down. Incredibly nice guys. Great guys. A lot of great speakers. William Bond was there, Billy Bond's son, who did, he spoke, always has valuable information. Grumpy Acres spoke. I mean, just a ton of great speakers there. Well attended, a lot of vendors, had a lot of fun in Bowling Green. And I urge all of you, if you want training, you're close to Bowling Green, Kentucky, come down the last weekend of June and take the full two-day class. It's a Homestead Medical Level 1, but it's a little different. I custom the classes to each time to what the people want. And we're going to be doing a lot of different things. I've taught there once before, two-day class. Jason's, this one's going to be much different. So it's a lot of stuff. We'll cover some of the cool guy ninja shit, but you'll be leaving there doing some minor surgical procedures when you leave. So it's good. I've got some new training equipment and some new things we're going to do. Tactical response in July, that Monday and Tuesday after the party at SOE and after alumni weekend there. We're going to be doing a two-day class at Tactical Response. They're hosting me, so come on down. Like I said, I've got classes everywhere, but each class, every time I teach, it's a little different because I customize it to what the host would like. So I I try to give them what they want and what their value is. And if you've never taken one of my classes, you know, if you have, we don't follow a timeline. You want to train longer, we'll train longer. You know, it's not an 8 to 4, 9 to 5 type thing. You want to go past 5 o'clock, we go past 5 o'clock. I believe class with Jason, we did 10, 11 hours each day, which I'm fine with. You know, you're paying me for service and I'm going to deliver it to you. Max is in the house. Max, how are you, brother? Max was just at the live tissue class we had the weekend after Self-Reliance Festival. Had a phenomenal time there. It was a 3-day class, live tissue, live fire, small unit tactics. Lewis from Tactical Response, and now also SOE, was the firearms instructor. We kind of do a co-class together. We spent one whole day on nothing but the pigs, controlled environment. Then on Sunday we did small unit tactics and live fire, and we had a blast. A lot of fun. We incorporated a lot of medical scenarios and stuff in it, and everybody learned something. Everybody had a lot of fun. Shot a lot of rounds, so it was good. We had a great time training together. I highly, highly, highly recommend you taking a live tissue class. There is nothing that can duplicate that. I can put all the silicone dummies out there you want. I can make the training things I have bleed and all that, but there's nothing that can replicate that live tissue stuff. But take one of my 2-day classes first. It's kind of a stepping block. I would highly suggest you have some good medical training under your belt before you come to live tissue, because it's next level. And there's no other one in the country that I'm aware of that anybody is teaching live tissue to civilians. We put on a really, really good class. Max was in it. You can ask him. He's in the chat. So yeah, come and train with us. You'll really enjoy it. I'm looking back on the comments. Dean, the Charlotte class is going to be my level 1 class, so we'll cover patient assessment, which is probably your most important skill. People don't realize that. We spend some time on patient assessment. We actually go over vital signs, what they mean, how to do them, how to actually do them. And no, not with a machine, you push a button. You're actually going to learn how to take a real blood pressure, a pulse, all your pulse points, assess breath sounds, all those things, and what they mean, what those numbers mean on that blood pressure, and what happens when they start changing. We're going to, we'll do some trauma review stuff of tourniquets. You know, we'll do arterial bleeding, how to stop that, the different types of bleeding, and all the trauma module as far as March goes. And then we're going to get into some heavy wound care, assessing wounds, you know, how to close wounds, different closure methods, but the most important thing is how to clean that wound, take care of it, long-term wound care. What if you don't close it? What if you've got to do wet to dry dressings for a month or 2 or 3 or whatever the case is? We're going to go over that. We're going to go over a lot of medical emergencies. We're going to go over fractures, dislocations. I'll show you how to reduce some dislocations, common dislocations. We're going to go over equipment selection, what you really need and what you don't need when you're prepping medically, the things you'll actually need. You don't have enough gauze. You'll hear me say that in all my classes. Trust me when I say you don't have enough gauze, come to the live tissue class. I'll prove my theory on that. We're going to talk dental emergency, stuff like that, some pharmacology, antibiotics, what antibiotic is used for what, and what your dosages are, and things like that. It's not just one antibiotic cures all. That's a misnomer. And then how to obtain some of these medications and other medications that are good to stock, and then some alternate uses for common over-the-counter medications that maybe you don't know of that you can use. And we get into a little bit of herbal medicine. That's not my wheelhouse yet. I'm studying it quite a lot. But Emily, who's also going to be at Kentucky Sustainable Living, she's doing a herbal medicine course, 2 days. She'll be there. Look up KentuckySustainableLiving.com. She'll be doing a class. I highly, 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 highly recommend you go take that class. She's a book of knowledge on herbal medicines and tinctures and remedies and stuff. And we're actually going to do some collaboration together and probably do a class together where it's kind of half traditional, and then what I teach, she's going to jump in and tell you what herbal medicines and stuff that you could use for that, say for wound healing and so on and so on. Tim, how are you? Tim's also been in the live tissue class. He can tell you about it. We were just discussing that, Tim. Yeah, I'm going to be in the be at the muster, Max. Sorry, I'm just going back reading these comments. Yeah, and Max just kind of reiterated you don't have enough gauze. I think he saw that at the live tissue class. Tim can pipe in on that. Takes a lot of gauze. You know, these pocket kits that I do, there's only room for 1 pack of wound packing gauze, and that'll kind of get you started. But actually, all my kits, as far as that I carry, I mean, I carry loads of gauze, wound packing gauze and stuff to pack a wound. But even in my belt kits and my line kits that are for me, I carry 2 packages. And I always have extra with me because you will use a lot. And, you know, if you go out on your homestead, if you've got a chainsaw kit, which this would be great, you could actually put another pack of wound packing gauze down in here. You could actually fit a couple, probably. And you should have that. If you're going to use a chainsaw, you're going to be away from people. Yep, have that tourniquet. But you may not hit an arterial, but you're going to have a nasty wound. You will use more than 1 pack of wound packing gauze. So what else is going on with you all? Classes that I've got coming up. I'm trying to. I hope to get up to Pennsylvania with Max and his group. We're working on some dates, and I'm going to be up there for the muster. I've got some other collaborations coming up with some other people. I'm going to be on some other people's podcasts coming up with some other people. When those are firm dates, I'll announce those. I've been invited on some bigger people, some of them surprising. But yeah, so we've been busy doing a lot, and I like it. But today, you know, like I said earlier, today I was outside most of the day. Planted some raised beds, just adding to the garden. Planted some peppers and some lettuce, and I'm going to do some more tomorrow. I planted some red bell peppers, green bells, some more jalapenos. I'm going to do some more tomatoes tomorrow. Probably some more chili peppers, some more tomatoes. I don't know, add some other stuff. Probably I might do some cabbage. Cabbage takes a while. I think I may try that. I'm going to do some potatoes too. Yeah, I know. What time of year it is. I'm still going to plant them. I don't really follow a lot of that, and I still grow shit. Yeah, I'm also going to be in Dixon, Tennessee. I forgot to mention that. We just haven't firmed up the date. Tim's part of that group, and Don Gorham, Homestead, John Witherspoon in that group. All that Dixon, Tennessee area is going to be there. This coming weekend, this Friday, Saturday, Sunday, I'll be in Camden, Tennessee for an event. So I'm going to be down there this weekend. So just traveling a lot, doing things, having a good time, enjoying it, trying to build this business up a lot. My son helps me a lot. Chase, who's in here, does a great job for me. It's a big resource. He mans the booth when I'm speaking or whatever at some of these festivals, so couldn't do it without him. So yeah, try to thank him. He doesn't get enough thanks for it. He helps me develop some kits and stuff like that and pushes stuff. So, and he's got his own stuff going on, his own little side thing going on, and he's doing, he's got on his property, we'll be doing a big garden out there. I help him with that, but it's a big garden that'll feed his family, me, you know, people on my side of the family, stuff like that, and we'll probably still end up giving away. Plus, we can a bunch of stuff. And my daughter-in-law is going to be canning some this year. I'm not doing it all. Yeah, I had some plants that I started from seedlings and stuff, and I transplanted those today. I've done some starts too, Max. Um, and I think I may try strawberries. Are you, Tim? You said you were picking strawberries. Um, I'm thinking about doing strawberries and maybe doing one of those green. I don't know what they're called, but they kind of start up top and they vine down. I may try that. I've never done strawberries before, so I'm thinking about that. I'm going to probably pick up some blackberry and blueberry bushes and for my son's property. We planted some there, transplanted some there, but they died. Didn't do well, so we're just going to have to do better. Plus, there was some flooding where we planted them. He had some flooding on the edge of his property and stuff, and of course, that's where we planted them, so near a creek bank, and we won't be doing that again. Thank you, Carrie. We love you all too. So, equipment, I've been seeing a lot of stuff people still talk about medical, and it's still put on the back burner. I'm just kind of curious, and it's kind of a wasted point of discussion in this group because a lot of you have been to my classes, and I know a lot of you have taken additional medical training. Why aren't people taking medical training? I mean, I get it, the guns are sexy and all that, and I love doing that and getting the equipment, and Lord knows I've owned a fortune. I would say a small fortune, but it isn't small. I told Amanda 2 years ago, never ever tell me what my total I've spent at SOE is, because she told me 2 years ago, I think at one of the SOE or one of the self-reliance, I don't know. I was down there for something. She told me what my total was. And I said, don't ever do that again. And that was 2 years ago, so God knows how bad it is now. I'm sure it's more than doubled. But why aren't you all taking medical training? Why aren't people investing in it, training to it? And I have people tell me all the time, raise your prices, raise your prices, raise your prices. I don't think my prices, I don't want to. I want people to afford to take it. I charge $450 for a 2-day class, which I think is a very good value. I know people, I'm not knocking anybody, so before anybody thinks that, I'm not. And I know people who charge $450 for a 4-hour class, which is an enhanced stop the bleed class. They've got a name, they can do it, good for them. I hope I'm there one day, but I really try to keep it affordable because I want families to do this. I want kids to do this. I've taught as young as 7 in my classes, and I'm not talking they were just there for a little bit. I'm talking like a full class. I've had 7, 8, 9, let me see, the twins were 13, I think, when they took one of my first classes. They've taken multiple classes of mine. They're 15 now. So I think, kids can do it, adults can, but why aren't you paying for it? Because carry that firearm. I 110% believe in that. Carry it, do it. I mean, can't pick one up, God forbid live, but here's I've got mags to load right there. Do it. Carry the firearms, take the training, but the statistics of you using that firearm and having to use medical, it's pretty big. You will use medical. I promise you'll use medical on yourself or a family member, or maybe even a bystander or something. You just roll up on something. You will use medical at some point. You will have to. You using that firearm, pretty low statistic. I hope you never have to. I hope I never have to. I've been in areas, I've worked, my past work experiences where we carried firearms. We were kitted up heavy. We've had to use firearms. So I hope you don't. I hope nobody does. But you will have to use medical at some point in time, whether it be traumatic, whether it be a medical emergency, whatever it is, you're going to have to use it. You need to be prepared. And you need to be prepared not just for the zombie apocalypse or grid down situation or whatever, but natural disasters, hurricanes, tornadoes. Look in Oklahoma right now. There's no 911. Nobody's there to help. They're not going to come help. Hurricanes, they're not going to. I always say, I look back at Hurricane Katrina. They didn't have a functioning hospital system for 6 weeks in the city of New Orleans. Every disaster area I've been to, that I've been deployed on, there was no help. And 911, it's not what you think it is. Remember, those people live in that community too. They're going to be affected. Their family's going to be affected. Do you think they're going to go to work, or are they going to take care of their family? I mean, that's not even a question to me, and nor would I expect them to. So you need to be prepared. You're not going to have a hospital system, elevated care, conventional medical care is not going to be available to you. It may not be available for quite some time. So can you take care of that loved one or yourself or whoever, your neighbor, part of your MAG group, whatever it is, your community, when you can't get to conventional medical care? And have you planned for that? Do you have the supplies for that? I just don't understand why people aren't prepping more for that. They've got the food and the beans and the bullets and all that, but why aren't you taking the training, and why aren't you building up your medical preparations? Yeah, everybody assumes help is going to come. You're right, Max, but they're not. And yeah, nobody thinks medical's sexy. I get it, but come to one of my classes. I'll surprise you. And no, that's not me wearing something, God forbid. Yeah, if you suck at medical, people can die. Yeah, see, Dean knows. Removing a cyst is hot, and I do teach you how to do that, because you know what's going to happen with that cyst or boil. You leave it alone, you're not going to have somebody to take care of it, where you'd normally go to your doctor. They could lance it, drain and, incise and drain it. It's going to get infected, and then you're going to let it go. It's going to guess what? It's not going to come out. It's going to go in, and when it goes in, it's going to get in your bloodstream, and then it's going to become systemic, and then you're going to become septic, and then you're going to die from a cyst. I'll teach you how to drain it, take care of it, take care of that wound. I have them made, little boils, cysts, whatever you want to call them. Yeah, Chase is talking about comms. Comms go hand in hand with medical. Take Evan's class, Radio Made Easy, radiomadeeasy.com. Telemedicine, you could reach out, you can, man, I got a big old bald head. I keep seeing because it's delayed on the feed. You got to have comms so you can reach out for help. But what if you don't have that, or you have somebody who maybe has more medical training? You need to do that, and that's going to be part of your community, your group, your mutual assistance group. So comms is also part of that medical prep, because maybe I can't get to you, but I could talk you through a procedure, and I do it. I do it all the time with people within the community. They call me, send pictures, stuff like that. I tell them what to do or what they need to do. It's funny, Nicole from Living Free in Tennessee, Hollow Rose Coffee, Self-Reliance Festival. I've consulted on Tactical Rednecks, for those of you who know him. Tactical Redneck, his various injuries many a times. Jace Medical Care is what you're talking about. She's talking about the online companies. There's several out there now. I'm actually working with one that's kind of within the community. It's more out towards the Midwest, with TAG, Midwest Preparedness Project guys. Life Done Free with TAG. Go like and subscribe his videos. Listen to him. He has valuable information. But Jace Medical does a real good job. I would trust them, but I'm trying to do a collaboration with a group of doctors who are starting to do that. and they do cut more of the direct medical care stuff. So you pay cash, that type of thing. But they're doing a service of the same type, and I'm going to try to get on board with them and at least promote it and steer people that way as far as antibiotics go, because you can't get them anymore. You can't get, your fish, even if they get sick now, you got to get a vet to write a prescription for it. But there's other ways to get it. You come to my class, I can tell you of ways you can obtain medications, legally of course, for the United States. Yeah, there's all kinds of different things. Yeah, I've had a good experience with them, Carrie. I've talked to them. I haven't ordered from them, so to speak. I called them. I had a bunch of questions just so I could pass it on, and told them what I was, who I was, what I do, and they were very, very helpful. I actually spoke to one of the doctors, and they answered every question I had, took their time. They're legit. They have good stuff. And you can also stock up on your prescription medications too. If you're prescribed a certain thing, you show them that, and you can actually stock up and pay for that too on some of the stuff. Antibiotics, things like that. There's a lot. And other additional prescription-based medications, say Zofran, anti-nausea, things like that. So it's a really, really good service to look into. It's jacemedical.com, I believe. I'll let you know about it, Carrie. As soon as I know, I'll let everybody else know. Um, so, what are you asked me? What would you all like to see? What are you all lacking? You think in your medical training, and what are you? What medical preps would you like to see? What haven't you seen that's not out there that you can get a comprehensive kit together? I'm putting together a dental emergency kit, and no, it's not some lame-ass dental kit that has a toothbrush and some toothpaste and a little bit of putty that'll last 4 hours to put in as a temporary filling. I'm putting together a real dental emergency kit with real components, and I'm going to partner up with Carrie from Thunderhill Farms. Where is her? See, right here. Thunderhill Farm. She's going to do some tinctures. Amanda Willis from SOE is doing some stuff. I've got a couple other people, but I'm doing some things with them to get some tinctures and things like that for stuff like that, and some more natural stuff that either I'm going to have them on my website in my kits. Some of them I'm going to have in my kits exclusively that you can get, and so we're going to do that. I've got putting together an ear, nose, and throat kit with emergencies through that. And really, a lot of times they're not emergencies, but can be. Dental emergency could be a big deal. If you've ever had an infected tooth or real bad toothache, I don't care how big or what a badass you are, it takes you out of the fight. I'm putting together a wound closure kit. This is one of John's what is this? Dual tool pod. I can't remember what he calls this, but it's got 2 pouches, zipper pouches, folds up, snaps. It's going to have suturing, stapling, other alternatives, such as zip stitch, steri strips, butterflies, closure methods, and ways to clean that wound first before you close it, or how to close it. So it's going to be a little kit that I'm doing that I'm going to have available. I'm doing some over-the-counter med kits, packages, and just playing around with some more different kits. I've got, like I said, this pocket everyday carry kit. It actually comes with the SOE pocket kit, and then I also sell this same kit without it. It's an everyday carry kit is what I call it. You can put it in whatever pouch, but it's small enough, something you can carry on your body. I do boo-boo kits. I do major trauma kits. I've got my whole, what I call the complete Homestead Medical kit, which covers everything. It has all the trauma stuff, all the a splint kit, which comes with 3 different splints in it. Comes with a burn kit. And it comes with a lot of long-term wound stuff and wound closure stuff, skin stapler, all that stuff, staple remover, all the different types of closure methods, um, and several other different things for just everything from boo-boos to major trauma to major surgery, and surgical instruments for wound debridement and things like that, or if you have to lance a boil or assist or take care of some minor surgical stuff where you do have to debride a wound, take some tissue away, things like that. All those surgical instruments are in there. And yes, you come to my class, you'll learn how to use them. But all that's in there comes in a 5-gallon tub. It's been very popular. I usually sell out of them at every festival I go to. I always bring more and sell more, which is great. But it's a whole complete kit of everything you need. Now, is there enough gauze in it? No, you don't have enough gauze. Buy gauze by the case. And yes, I do sell gauze by the case, 2x2s, 4x4s, gauze rolls, 5x9s. You can buy them by the case on my website, and I will ship it to you. But in this, you can take care of a wound. You'll have enough in there to where you can pack and clean and take care of a wound for, depending on the size, a normal size wound. I mean, what's normal? But if it's a very large wound, it'll probably get you through 2 to 3 weeks. An average size wound, a month or more. Smaller wounds, you can, but it even has some dental emergency stuff in there, things like that. Like I said, burns, covers everything. That's $350 shipped to you. I have those available right now. I've got a couple that are already actually pre-built. Normally, when you order from me, I build your kit in. I don't remember what's in this box. Joshua Smith, I'd have to look. I think he got a vehicle med bag fill kit. But I built this and put it in the box, packaged it, did everything. I have very few things pre-built. I do it when you do, and a lot of times I throw in an extra thing or two. Because I'm looking at it going, you know what, you need that. And I add to it, and it's not even in the description, but you find out when you open it. So I think it's important. Oh yeah, you don't have enough gauze, Gary. It is kind of my tagline. Yeah, Tim, the pediatric young adult training. I teach a little bit of it, but that's a whole specialty. And it's funny you mentioned combat midwife. We spoke. We had a very long conversation. We're actually going to be doing some collaboration together, kind of pushing our audiences too. She specializes in OBGYN and pediatric care, and that is kind of a specialty. I do teach some pediatric stuff because they're not small adults. It is different, but OBGYN stuff is very different. She's selling her own line of kits for that, home birth kits, stuff like that, and we may collaborate on those together where it's kind of a joint venture in the kit. She's a paramedic. Also, she teaches a lot, that specialty to military services. I'll just say that. We've ran in the same circles, know a lot of the same people. So she's an excellent resource. Combat Midwife. Go subscribe to her YouTube channel. Tell her I sent you. But we're going to be doing some collaborations and things together. We're coming up with some kits. You maybe see some of her branded kits on my website, or really it's going to be a collaboration of a kit together. Have both of our names on it, but we've got some stuff coming up. I do Aurora rings. He wants to know if I have a car kit. It's the SOE. If you look on my website, it's the vehicle med bag fill kit. It will fit in that tool bag light. I've got several different kits. Look and tell me what you want, and if you don't see something that you want exactly, just send me a message. I'll custom build you a kit. Just charge for the components. Or if you want something added, we just add components. But just reach out to me, and I'll more than happy to build you custom kits. It's another thing I do. I build what you want. Max, by the way, if you're still in here, I do have your IV stuff. I need to send it to you. I was actually kind of holding it. I was going to bring it to you if I come up for muster. Then I realize muster is a far good ways away, so I'm just going to ship it to you. Yeah, I can get you IV things too, IV start kits, the supplies that you need for that, even in case quantities, IV fluids, things like that. And come to my advanced classes, and guess what I'll do? I'll teach you how to start an IV. And it's no, guess what? There's a technique to it. Guess what? There's a technique to everything. There is a technique to putting a pressure bandage in an emergency trauma dressing. People don't realize that, but there is, because people do it wrong. I've seen them wrong. I've seen several people put them on wrong. People are teaching it wrong. It's just not wrapping around. Make sure it's kind of tight. There's a whole process to that. There's a technique for everything, and that's something I make sure you know, because people are teaching, and the people who are teaching it, sorry folks, a lot of them don't even have medical experience. They've never treated a patient. They've never put a tourniquet on. Vet your instructors. Please vet them. I can tell real quick when somebody's teaching who doesn't know, never done it. You know, I'm pretty sure you wouldn't go to a firearms instructor from somebody who's never shot a gun, or doesn't have, proven success. Well, guess what? Check your medical stuff. If it's cheap and sounds too good to be true, that's because it is, because they've never done it. I know you do, Jason. I've got yours too. Angel, I do not. I was actually, it's funny you say that. I've had a couple people request that. I'm actually going to be doing a video series on how to pack a compact tear-off kit, the medical backpack, a SOE vehicle med bag. You just watch me pack this, the pocket kit, but I'm also going to do the MCAB. I have fill kits for all of those. It's kind of customized though, and I don't put them on the website, but I do fill kits for the medical backpack and the MCAB, because those are customized to you. I don't know who's in your family, what you're packing for, what you need it for, and then it gets customized for kids, size, how old are the kids, that type of thing. And then I also get into some medical history of your family to see if we need any special things to be put in there, because those are kind of a whole host of stuff. The complete Homestead Medical kit that I was talking about earlier will actually fit into the medical backpack also. So I do have a fill kit for it. You just get a free 5-gallon tote with it too, and it's the good ones. It's not cheap dollar store ones. I buy them at Lowe's. Yeah, stomp bag. We're going to do, Jason's got a medical backpack that we're going to do a video together on and collaborate. Did Max use his tagline, the fucking tourniquet? Sorry, I'm just trying to catch up on some of this. Yeah, eye stuff. I teach about how to flush eyes and do all that. Glenn mentioned about eye emergencies. Just making sure I didn't miss any questions or anything. Yeah, we can do that, Angel. Just get a hold of me, send me an email, chuck@homesteadmedical.us, and we can set up a phone call. And I ain't gonna cost you. I don't charge for that. We'll talk and see what we can put together for you. So what would you all like to see training-wise? I mean, I'm open to anything. I've got a varied experience. I've kind of done a little, I won't say everything. I'm by no means a medical expert, but I've been there and done that on a lot of stuff. I consider myself a medical practitioner. I've been a lot of places, done a lot of things. I've worked a lot of non-traditional medical roles as far as being overseas, and even here in the U.S., remote medical things where, I was the doctor, so to speak, and have done a lot of advanced procedures on people, and I feel comfortable. I won't teach anything I'm not comfortable doing, and I won't teach anything that I've never done. when I teach the wound care stuff, this is all stuff I've done on real patients multiple times. Yeah, Angel, as far as the medical backpack goes, I've done. If you've ever taken Evan's class, Radio Made Easy, the backpack he has in there, medical backpack, the stuff in it is mine. I've done multiple people's packs and custom kits, and we've done kits for law enforcement agencies and training groups and all kinds of stuff. So whatever you need, we can do. Yeah, there's a technique on how to apply pressure dressing and different dressings stuff. Tim had mentioned that there's definitely a technique. Different dressings are different. Which ones you have, which ones have that kind of help you, believe it or not. To have the little Velcro tabs on it so the dressing doesn't go all over the place like an old Israeli bandage. Little things like, these emergency blankets. These little foil, that's important. Shock is going to kill somebody. You can stop the bleed, but they're going to be in shock. And if you don't treat for that afterwards, and that sustainment treatment, they're going to die. So those are the things I teach, and it's not really pushed a lot in stuff. We even go over medications. This is one of my light's bad. This is one of John's IV med kits, but I've got actual medications. This is actual one of my kits. I've got everything in here from albuterol, oral glucose, the syringes, everything. I've got, Narcan. And I'll teach you about Narcan. It's not just what you think it is, but there may be some IV medications or something. But we'll talk about things like that if you do get a hold of things. That's some of the stuff we talk about. But what classes, what do you all feel like is something that needs to be put out training-wise that you all think is important and needs to be out there? Suturing techniques, and it's funny you say that. I'm going to be doing some this fall. Look for that at some of the festivals. But I am going to be doing an actual suture class. And I know what you're saying about layers. Inner stitches, that's a well-advanced class, and really you're not going to have probably the supplies nor technique. Suturing is not something, you can go and there's a husband and wife that teach a suture class that for 3 hours you go in there, they teach you a couple stitches. They don't teach you anything about cleaning that wound and what to do, and they teach you a couple of running stitch and maybe one other one, and I could spend weeks on suturing alone. It's a whole art form in itself, but rudimentary suturing, most suturing is done for cosmetic reasons. One of the best things you can have on hand is this skin stapler. This is an actual medical surgical grade skin stapler. 35 wide staples in this one. Yes, it is reusable. If you only use 5 staples in somebody, you don't have to throw it away. I'll teach you how to take care of that and how to sterilize it. But you can do 80% of lacerations, 85% of lacerations you come across with a skin stapler. You can take care of it. Just going to leave a bigger scar. Yeah, I can do vehicle-specific crashes, things like that stuff you can come up. We can do scenarios all day long. Good Lord, I worked traditional EMS for well over 20, I guess all in total about 25 years between flight and ground work and all that. I don't know how many car wrecks I've been on, and I've seen quite a bit. And then also on the fire side, when I worked as a firefighter, many extrications and rescues and things like that too. So we can do that, Tim. That's no problem. I can come up with anything you all would like to see, but I really want to focus on stuff that is not also talked a lot about: the dental emergencies, the ear, nose, and throat stuff. Just general like sickness. Because it's not sexy stuff. It's not putting a tourniquet on. You got to take care of somebody who's sick, septic. Do you have the supplies to do that? And do you know what to do as far as basic nursing care? You're going to have to monitor urine output. That's right. You're going to have to look at pee. You're going to have to, see what their intake is, what their output is, all of those things, and how to do trending vital signs and those things, because that's not the cool. But do you have that equipment, and are you stocked up for that? I know somebody right now that's getting stocked up for it, that's putting on a full-on surgical suite, x-rays, everything. They're going to have everything there to be better prepared. They have the means to do so. Good for them. And I'm helping them doing some equipment selection along with some other people. But, are you prepared for that? And yeah, you still don't have enough guys. I do, Angel. You can actually buy the staple removal kit and the stapler with me. It's just a little tool. It's $5. It's $20 total. 15 for the stapler, $5 the removal kit. But it's a specialized for skin staplers, how it comes out of the skin. And I'm fairly certain there's probably somebody here. Well, I know there's somebody here in the chat. Jason has taken staples in one of the classes. He'll tell you, doesn't hurt. And he had them removed. Pretty easy. Yeah, we can do the everyday thing, Jason. It's the nursing care, and that's what it is. But it's the specialized part of it. It's not just, giving a bed bath and all that, even though some of you would like that. No, I'm not giving any of you all a bed bath. You're on your own on that shit. But it's more about that. And then, another thing that's not talked about that's always the medic's responsibility, and this is something that surprised me when I started working remote stuff and overseas and stuff. Sanitation. You become responsible for that. I became a sanitation officer, a food health and safety officer, an overall safety officer. So that's a lot of stuff that you have to look at as your sanitation. I mean, do you know how far to put a, outhouse away from your water source or your well or a freshwater source? Do you know how deep to put it? What to use? All those things. Food safety, all those things and what you do, because this is what's going to happen. Those common diseases of typhoid and salmonella and all these things, that's what's going to come up and start killing people again in a grid down situation. Hepatitis A, and that's strictly from poop, folks. It's fecal matter, and that's what it comes from. You're going to start seeing all those things. What do you do? How do you treat it? All those. That's some of the stuff we go over, so you can be prepared for that. What antibiotics? Because there's certain antibiotics to treat, and there's some you don't give an antibiotic for because it doesn't require one. There's other medications that you can get. So what are you going to do? Carrie wants to know how to manage common issues in a grid down situation: high blood pressure, migraines, blood sugar, arthritis, etc. Which is a great question. Some of it you can. If you're insulin dependent, I will tell you how to stock up on insulin. Little tricks you can do. Find a like-minded doctor or a doctor who's willing to work with you on that. But if you're an insulin dependent type 1 diabetic, some things that you can do to lower that. Obviously diet, but there's other natural remedies that could do, and there's medications out there that you could take oral. Arthritis, blood pressure, migraines, there's a lot of stuff that can do, and then you kind of go back to the old ways, and that's where I start pointing people to some of that stuff, and that's why I rely on people like Carrie, who makes things like that, and those tinctures, and and stuff like that I want to be able to include in my kits, that you have that and you're stocked up for. We'll go a few more minutes. What equipment would you all like to see? What do you think is missing at your preps? I think sanitation is a big deal that is not talked about a lot, and how to do it. How do you keep wounds clean, and how do you just, when you're taking care of somebody long term and you're low on resources, yeah, tick-borne diseases. We can go over that, Tim. That's pretty good. How do you remove a tick? Some people don't realize little tricks, things like that. I mean, I know what everybody says as far as that goes, but do you know how to do that? What's some of the little tricks you can do? You could take a cotton ball, put Dawn dish soap on it, get it wet, and put it over the tick where it is, and they'll release and they'll actually come out of that. Vaseline kind of works well with that too, but soap works better. Just removing a tick, and it'll let go on its own, so you're not left with the head in there. But how do you dig that head out? I've done that, I don't know how many times. And man, when especially in Puerto Rico, I was down there a year and a half, recovery effort for Hurricane Maria, and a lot of ticks down there that we had to dig out of people, especially the guys that were actually in the actual jungle and the rainforest of there. A lot of insects, and there was a lot of plants we came across that is native to there. You don't find in the United States, though. We had to figure out, and actually how to treat them. I went to the old locals. What do you all do when this happens? And then they were telling me how to treat it. So there was a few things that we came across that just weren't familiar with, and how to treat it. Mr. Lester, Bennett Lester, there's one of my students who's taken quite a bit of my classes. Yeah, guinea fowls will take care of your tick problem around the house. Bennett 3-day pack. I would definitely put, besides an IFAC, I would definitely get a splint. Hold on. Yeah, there's no reason why you can't. Sorry, I had to go to my drawer, my stacks of drawers. I've got all my equipment. I mean, look at that. Look how small that is. That's a SAM splint that you can fold up, and this is packaged this way. You can unfold this more, make it flat, put that down in a pack. I would have a lot of gauze. I would have a wound care kit. Obviously, Band-Aids. Always have boo-boo kits. You're going to use Band-Aids more than you will anything else. I would definitely have some instruments to remove things like a tick and things like that. And then also think about preventional things like moleskin. Nobody thinks about that. That's in all of my larger kits, my backpacks and stuff, for blisters and stuff like that. Burns. Nobody ever thinks of burns. My vehicle med bag fill kit has burn treatment in it. Little burn ointment, stuff like that. All that stuff. I put that in there because, in a car wreck, you're going to come across that. But everyday stuff, burns and stuff like that, and it's those minor wounds. And I would definitely keep a syringe, Bennett, like at least a 12 cc, but preferably a 60 cc syringe. And yes, you can get them from me before you ask, Bennett, because I know you'll be calling me. A 60 cc syringe with a there's different ends. This is a slip in. It kind of concaves down. It's made for irrigation, to irrigate wounds out, clean them out, and then also have the triple antibiotic stuff, things like that. But treated water, treated tap water is just as effective as saline. Look it up yourself. I know. Yes, I just became. Once again, I'm proving myself to be a domestic terrorist because I said go look it up. But do that. Treated tap water. And if you're out in the woods, you've got a 3-day pack, whatever the case is, boil the water. take it through a water filtration system, whatever you have, a Grail or MSR or something like that. Boil the water, filter it, treat, and then you can use it to, not while it's still hot. You don't want hot water going into a wound. You also don't want cold water, room temperature. If it's, your body temperature. Yeah, it actually, that, if you read what Carrie's comment was when she had earaches, used olive oil and fresh black pepper on a cotton ball, put in there, acts as a drawing salve. It actually draws out that infection or whatever, that fluid that's in there in your ear out, so you won't have that earache. Spags! Yeah, water treatment tablets, filter, exactly, Tim. You can make clean water, and that's really all you need to irrigate a wound from. If you can drink it, you can irrigate with it. Just that simple. Um, so, yeah, 3-day pack. Also, Bennett. Yeah, the burns, the minor wounds is your biggest thing because that's what you're gonna have, and then have a splint, have ace bandages, have a splint kit, and tape, medical tape. Because if you're working, you put a Band-Aid on, you're going to sweat. That's going to come off. If you get this cloth medical tape, yes, it comes in my kits. I put it with all my IFAKs and all the other medical kits, wound care kits, and I have a specific wound care kit too, not just the big one. If you look on my website, I've got a couple different ones. The advanced wound care kit, it may say it's out of stock, but I actually have stuff back in. Um, so, but yeah, medical tape. Wrap that around your Band-Aid so it'll stay put. Another thing, nosebleeds. I did a video on this quite some time ago. These are, they're for nosebleeds. They're little cotton balls, little stripped. I don't know if you can see that on there. See how they're small? You can kind of see how big they are. You coat those in Vaseline, put it in a small little plastic bag like that. Throw a few in there. It's great for nosebleeds. Put it up there, it'll stop the nosebleed, and then that way you can pull it out. It's not stuck, and it won't pull that clot out that formed that you use that for. You can also use those as dental plugs. I would keep a few dry that you could go in like an open socket. You lose a tooth, have a tooth come out on that. You can plug that in to temporary relief so you don't have that air and everything else contaminants going in that open socket where a tooth used to be. Train on remaining calm during an emergency. Well, I'm not even sure how I can do that. Um, I could tell you things to do, but it also comes with like any other type of training. It's mind focus and it's confidence. You've got to focus on what you're doing um, at the task at hand and put everything else. I mean, there's plenty of times I've walked up on something and I've looked at something in my head. I'm going, oh, fuck, that's bad. Or, oh, they're screwed. Or, oh, they're going to lose that leg. Or, oh, I don't know if they're going to live. Or, that's just, they're fucked up. You just have to focus at the task at hand, put that behind, put the emotional, and the emotions will get to you afterwards. I'm not going to sit here and say it doesn't with me. It does. It has. So, yeah, it's just something, experience, confidence, and good training to focus on the task at hand. It's very hard with a family member or loved one or person you care about to do that. It's not easy. I wish there was some magic little thing I could give you to get over that, but it's not. Yeah, sports tape, the self-adhesive wrap, Tim, I put those in my splint kits. I add those in all my big kits, the vehicle med bag. That's a great thing. The vet wrap, Bennett, is what he's talking about, which you know what that is. Put put that in there also. That's a good idea, Tim. All right, any last comments, anything else? I've been on here over an hour. Jump off here. I've had a long day. And I think John's getting ready. He's getting ready to do his live. So you all hop on over there to Special Operations Equipment. Go on to John's live and give him a like too. Please like, subscribe to my. I always forget to say that, like everybody else. But please, if you haven't, subscribe to my YouTube channel, all my social media and stuff. I appreciate all your support. I appreciate all of you who have ordered from me and bought things from me. It means the world that you support me. You know, I can't thank you enough what it means. I'm trying to build this business to where I get off the paycheck plantation, and this is my sole source of income, which I'm doing my damnedest to do so, and I will do it. Just trying to do it as much as I can, but if there's anything I can do for you all, don't hesitate to contact me. You can email me, chuck@homesteadmedical.us. My website is chuck at homesteadmedical.us. I'm on all the social media stuff, TikTok, Instagram, Facebook, you know, all that stuff, Homestead Medical. You know, ask me a question, get on my website, see if what you have. If there's not something there that you want specifically, don't go looking somewhere else. Send me a message. I could probably get it for you. And maybe something I haven't thought of would be, hey, that's a good idea to have. Or maybe something I have, I just don't have it on the website. There's some stuff I don't put on there because it's like the custom kits. We can do custom kits, but I can't put a price there because it's based on the components that you have. And I don't charge any extra to do a custom kit because really every kit you order is a custom kit because when you order it, that's when I put it together. Thank you, Cheeseburger XJ. I don't know if we've ever met, but thank you. I appreciate your support. Carrie, thank you for everything you do. You're always one of my great friends, her and Glenn. ThunderhillFarms.com. Go order her stuff. The bacon jam is crack. The salsa verde I use on everything. Now I'm kind of addicted to it on my eggs in the morning. I actually had it on ribeye night before last. And last night I put it on a pork loin. I've had bacon jam on the pork loin, all of her stuff. I'm sitting here thinking of everything that I have. And the jerky dip that she has, a beef jerky, she calls it a dip, but it's like a sandwich spread almost. Phenomenal. Everything she makes is great. Go to Thunderhill Farms, support her. She's part of the community. Max's Path, Max was on here earlier. Subscribe and like to his videos. Spags Unfiltered, go to his stuff. Like and subscribe to his videos. Midwest Preparedness Project. Kentucky Sustainable Living, that's Jason Sparks. He's part of our network. Go sign up for his stuff. Go to the the last weekend of October. Will be the next Kentucky Sustainable Living Conference. I'll be there. I'll be doing a pre-conference class. Carrie will be there. SRF, Self-Reliance Festival, will be the first weekend of October. Go there. All of us will be there. Most of the people in here will be there. So, yeah. Thank you for your support. If you need anything, don't hesitate to contact me. I appreciate you all. If you need any equipment, please reach out. Check out the website. You don't see something that I don't have, reach out to me. I'll get it for you, and we'll get you set up and get you confidently prepared. And come take my training. Last weekend of June, Bowling Green, Kentucky, Kentucky Sustainable Living. Go to KentuckySustainableLiving.com. Sign up for that class. July 15th and 16th, I'll be in Camden, Tennessee at Tactical Response doing a 2-day class. You can sign up at homesteadmedical.us. August, like the weekend of August 17th, be in New London, Ohio. You could sign up for that class. It'll be a 2-day class. That is on my website, homesteadmedical.us. I will be in Charlotte, I believe. It'll be the first weekend of August. Those dates will be coming out very soon. I'm working on Chattanooga. Dixon, Tennessee should be August, September coming up, maybe even July. towards the end of July. And I'll have a class here in West Virginia in May. Trying to think. I still may be doing a class in Camden at Special Operations Equipment in June, mid-June or something is when it was originally scheduled. So I still may be doing that class too. If interest is there and people want to come and hang out and take a 2-day class at the SOE compound. John and everybody else will be in it, probably. So yeah, if you want to host a class, come let me know. I'll be up in Pennsylvania come this fall, Florida this fall, coming to Wisconsin at some point in time when Carrie tells me to. She just has to tell me when. And anything else, you all let me know. Thanks a lot. Appreciate you coming by, chatting with me for a while, and I appreciate your support. Thanks. And remember, you don't have enough gauze.